Assalamualaikum warahmatullahi wabarakatuh to all lecturers, audience and fellow coursemates. So today for Journal Club presentation, my groupmates and I from Group 1 will be presenting an article entitled Social Media as a Tool to Promote Health Awareness, Results of an Online Cervical Cancer Prevention Study. This presentation will be presented by me, Arifah Fitri binti Muhammad Hassan, Muhammad Amir bin Nazri and Putri Ainin Amalin binti Azrul Hisham. Before we proceed with the presentation, I would like to give acknowledgement to the authors of the article. They are Helena C. Lyson, Jem M. Le, Jingwen Zhang, and other authors that participated. They are from Center for Vulnerable Populations, Division of General Internal Medicine, University of California, San Francisco, USA, Department of Communication, University of California, Davis, USA, Helen Diller Family Comprehensive Cancer Center, University of California, San Francisco, USA, Department of Obstetrics and Gynecology, University of California, San Francisco, USA, and Annenberg School for Communication, University of Pennsylvania, Philadelphia, USA. This article was published online on the 11th of June 2018. The contents of this article include introduction, methods, which are divided into three: study design, measures, analytic strategy, result, discussion, conclusion, and lastly, references. To start off, cervical cancer is highly preventable, yet more than 4,000 women will die of cervical cancer each year in the USA. Papa Nicolaou, or also known as PEP test, and human papillomavirus HPV vaccines are important cervical cancer prevention measures. However, only 83% of women in the USA reported receiving appropriate PEP test screening, well below the national target of 93%. And only 43% of girls aged 13 to 17, also known as teenagers, are up to date on all the recommended vaccine doses for their age. To continue, online social media platforms like Twitter and Facebook represent a promising opportunity for public health promotion. Research is limited, however, on the effectiveness of social media at improving knowledge and awareness of certain health topics and motivating healthy behavior change. Thus, the aim of the study is to evaluate whether participating in an online Twitter-like social media platform and receiving brief messages or tweets focused on HPV and cervical cancer prevention is effective at increasing knowledge, awareness, and prevention behaviors related to cervical cancer.
Method consists of study design, measure, and analytic strategies. Firstly, I will be talking about the study design. The study investigators designed an anonymous online platform called Health Connect. This platform is for discussion regarding HPV and cervical cancer prevention. Around 900 messages based on actual tweets from Twitter were created. These messages include both factual information and personal experiences. Study participants were recruited online using an advertising-based strategy through posting in social media sites and targeted email lists. Individuals were eligible to participate if they were female, 18 years old or older, lived in USA, spoke English as primary language, and did not have cervical cancer. There are 985 individuals complete the eligibility screening, 44 ineligible, and 862 consent to participate. Among the 862, 80 failed to respond to the enrollment invitation, while 782 participants enrolled in the study. Enrolled participants complete a baseline survey. Out of the 782 enrolled participants, 765 complete the baseline survey with completion rate 97.8%. All participants were randomly assigned to 9-person group on the Health Connect platform. The 900 tweets were subsequently distributed to each online group over 5 days. Each participant received a daily message stream with a random set of 20 tweets. At the end of the study, participants were asked to complete a post-survey. A total of 569 participants complete the post-survey with completion rate 72.7%. For measure, a few questions were asked in the baseline and post-survey based on few aspects. For HPV awareness, have you ever heard of HPV? Knowledge on HPV was assessed by 4 questions. Do you think HPV can cause cervical cancer? Do you think you can get HPV through sexual contact? Do you think HPV causes AIDS? And do you think HPV can go away on its own without treatment? For HPV vaccine awareness, the question is, have you ever heard of the HPV vaccine or shots to prevent cervical cancer? If the answer was yes, did you receive all 3 doses of the HPV vaccine? For vaccine interest, will you be interested in getting the vaccine? Vaccination behavior then was assessed by 2 questions. Have you ever received the HPV vaccine or HPV shots? And if the answer was yes, did you receive all the 3 doses of HPV vaccine? Finally, pap test behavior was assessed by 1 question. Have you ever had a pap test to check for cervical cancer?
Now I'm going to explain about the analytic strategy. Baseline and post-survey response were compared using McNemar's test. All analyses were conducted in SAS 9.4. The probability value less than 0.05 were considered statistically significant. So the result consists of 3 survey or 3 components, which are: first, here we have a characteristic of study population. Second, we have comparison of survey response. And the last one is, ever heard of HPV survey response by demographic subgroups. According to Table 1, characteristic of the study population, the majority of study participants, 71%, were white people and had a college education, 64%, and the majority of participants, 79%, were above the age of 26, and nearly one-third reported a household income of 75,000 or more per year. Now, if you look at Table 2, comparison of survey response, the researcher noticed that there is no statistically significant change in any knowledge or behavior related to HPV or cervical cancer prevention from baseline to post-survey. But the researcher found that there is a statistically significant change in response to whether participants had ever heard of HPV, increased 4%, from 90% to 94%. The probability is 0.003 from baseline to post-survey. Now, according to Table 3, ever heard of HPV survey response by demographic subgroup? The change in response to ever heard about HPV between surveys was statistically significant for those over the age of 36. The probability is 0.002, while for the Asian, the probability is less than 0.001. The people of other race or ethnicity, the probability is equal to 0.001. The percentage of those who reply yes to the question increased by 5%, 9%, and 8% respectively. Individuals with all levels of education and incomes were more aware of HPV, but no statistically significant increase were observed within specific education or income groups.
Next, let us proceed with the discussion of this article. So firstly, even though they did not find any significant increases in knowledge or behaviors among study participants at the conclusion of the study, they did detect a small statistically significant change in awareness of HPV. Second, the findings revealed that most study participants already had substantial knowledge, awareness, and engagement in positive behaviors related to cervical cancer prevention at the start of the study, thus leaving only a little room for improvement. Third, the duration of study period, which are 5 days, was likely not long enough to substantially change behaviors. And lastly, HPV awareness can be increased through brief participation in an online social media platform. To conclude this article, Findings suggest that brief messages on social media can positively influence awareness of health information. Second, social media can be leveraged to promote awareness of specific health topics by connecting individuals with one another, organizational information, and personal experiences. Third, public health organizations may find social media as an effective tool to raise awareness of health information by spreading brief messages to targeted populations. And fourth, more research is in need to explore how social media can be used to improve health knowledge and adoption of healthy behaviors. These are the references of the article. That's all from us Group 1. Thank you for listening.